It's 3 weeks since Christmas time, and that's around the same period of time that many experts say that, happens or goes through between infection and death in the event of those people who do die. But of course, Christmas also coincided with the influx, the surge in the new UK variant. Now, Boris Johnson did come under pressure throughout much of December, over his plans to relax coronavirus restrictions at Christmas. Ultimately, he did relent, but only in the last few days before Christmas, by which time many people had plans made and it would be very hard for them to cancel it. But I think what we're dealing with here is really a clash of politics and science, and the science really hasn't caught up yet with definitive answers. It does certainly give Boris Johnson's opponents a strong case to make, and we heard that from the Labour leader Keir Starmer today, who pointed out that as recently as December the 16th, the Prime Minister was saying that they were seeing a significant reduction in the virus and there was no need for endless lockdowns. Of course, history has turned out quite different. But one doctor who I spoke to just in the past week or so is not so certain that Christmas really can be blamed. I'm sure some others will think otherwise, whether it ultimately was the relaxation of Christmas or perhaps the release from the November lockdown or purely this new variant. I think science needs some time to catch up with that, and we haven't got that answer just yet. Now, the Prime Minister, in announcing it today, didn't give an awful lot more detail than that. There is a pilot vaccination centre running 24 hours going to get up and running. He said you could expect more details in the next few days. But I have to say some experts who I've spoken to are a bit dubious as to the methodology or the strategy here. Keeping in mind, and even as Boris Johnson pointed out in making the announcement today, the biggest obstacle to getting people vaccinated right now is not opening hours, it's actual supply of vaccine doses. We're still waiting for manufacturing capacity and that supply to catch up with the demand. It will only make sense when there is enough supply to actually keep those vaccination clinics going throughout the clock. Right now, those big new vaccination centres that we've been reporting on are open for 12 hours a day. We're not there yet in terms of supply yet. It's not clear when we will get there, but I'm sure many people, if we do get to 24/7 vaccinations, will be happy to turn up in the wee small hours of the morning.